So ADHD is one of the most common things we see here at the clinic. Parents bring in generally children with ADHD. I would say that it's at least 50% of our cases. ADHD is a neurodevelopmental disorder, and that means that it's a disorder of the way your brain is developing as you grow up. It generally presents with three broad ranges of symptoms, and they are inattention, impulsivity, and hyperactivity. And what we also tend to see as well alongside that, or mixed in there, is emotional regulation problems. So difficulty with holding in impulses, and that extends out to emotions. So difficulty with controlling anger and sadness and those kinds of things. People generally notice ADHD or the kinds of symptoms that they see when children are coming to 3 or 4, when they're being challenged to organize themselves, for example, to go to play school or creche or to primary school. You generally see the same thing happening in the morning time when children have to get their school bag and they have to get their lunch and their shoes and their uniform and their books and their copies. And children get overwhelmed by the inability to organize themselves. They can tend to be hyperactive anyway, tend to be unable to pay attention to what they need to do and to instructions that they might get from the mum and dad. So you get a frenzy of activity generally in the morning. And people can generally accept then that this is not what other children are experiencing every morning. And at that point, people often come and look for help. The typical setup is something like asking a child to put their shoes on, going to send them upstairs to put their shoes on, and 10 minutes later the child hasn't arrived back down. And mum or dad or somebody shouts up the stairs and says, where are you? We got to get out the door. And you go upstairs and typically somebody's reading, or they found their Lego, or they're on a mobile phone and they've got one sock on and they can't find the other sock and they've just got distracted. And that cycle tends to continue then because everybody gets frazzled, everybody gets upset, and then by the time the child gets to school, everybody's late and slightly upset in the morning. And that inattention and hyperactivity then continues into school. So the children find it difficult to pay attention. They forget books, they forget copies, they forget to write things down. They're generally disorganized. They get up and fidget a lot or move around from their seat and tend to get into trouble quite a bit with the teacher. Then when it comes to playtime, they have difficulty with hyperactivity and impulsivity. They struggle, for example, to hold their place in a line. So they'll jump to the front, and of course that upsets everybody else. And then they get into more trouble, and then their friends don't want to play with them because it's really difficult to play in a game where you have to take turns. And a child then has found that they've spent a whole day where they have been unable to pay attention, and things are happening that they don't quite understand, and they can't organize themselves, and they're getting pushed out of the group because they're difficult to deal with. So that over time then self-esteem begins to reduce because children are getting more and more ostracized from their group, and they're always the one who's been given out to. And that then becomes self-fulfilling in that they get more and more anxious about trying to do the right thing, and they can't do it, and they get pushed further and further and further out. So by the time children and parents arrive at the clinic, they're not only worrying about ADHD or the problems in school or the problems at home, but they're also worrying about their child's self-esteem and their own sense of value. And one important consideration, and one question we ask to parents and to children is, are these symptoms appearing across multiple settings? Is it happening at home, with friends, in school? And if it is, you know that it's something that's not state specific, but that it's actually something that's more generalizable or general, like ADHD. Families can often find that their lives become quite chaotic when there's somebody with ADHD, and they can often then struggle to understand where to go or what to do or how to even find out more information about what their options are. And as I say, the people often go to their GP or see a psychiatrist or a psychologist. And the first thing is there are lots of different services available and lots of things that people can do. So for instance, medication is quite often used. So there'll generally be some type of a stimulant involved. So people will have heard of Ritalin, for example. That's typically prescribed. And medication certainly does have a role in some cases. As well as that, there are behavioral interventions which people can look at, and that's to help structure behaviors at home with the family, structure behaviors in school. And there are cognitive approaches, there are different talk therapies that are involved, different types of supports that a child can put in place. And then there are newer neuroscience-based type of interventions like we do at Actualize. So as well as having all of the traditional approaches that one might expect, like behavioral support and the talk therapies and strategies, for example, we're focusing now on neuroscience-based interventions. So that is looking directly at how a person's brain is working and looking at an intervention that's going to deal directly with whatever brain dysregulation we might see in every particular case. So even something that's as consistent as ADHD, where you can have 10 children with ADHD all presenting with the same sets of symptoms. If we look at their 10 brains, we can see that those 10 brains are quite different. And as a result, you need to have some kind of a personalized approach to that. So we can do that by measuring what the children's brains are doing, by putting sensors on their heads called EEG, and that just records the electrical activation coming from their brains. And from that, we can build nice 3D brain models, functional models of what that person's brain is doing. And we can compare it then to a normative database. And by comparing it to that database, we can see where that brain is similar and where it's different. And in those areas of difference then, if they are important areas for attention or controlling movement or controlling hyperactivity, we know that they are the brain areas that are responsible. And then our intervention can be tailored directly to deal with those brain areas for that particular person. If you suspect that somebody has ADHD, and by the time people arrive at us, they either have a diagnosis or they don't have a diagnosis, but they're fairly sure that something's wrong. So they're getting feedback from the school, for example, or from friends or friends' parents, or from granny and granddad. People have a lot of options. So the first thing you can do is you can actually get an ADHD diagnosis, formal ADHD diagnosis. And what that can do then is unlock resources for you in school and elsewhere. And people find that quite useful and validating, because then you think, okay, this is the thing I have, and it's predictable, and there are things I can do, and other people have it, and it stops becoming this big unknown. Informal diagnoses are useful, and of course we can do those here at Actualize. But the assessment piece for neurofeedback training, or for neuroscience-based interventions that we run here, is slightly different, and it's tailored directly towards the intervention itself. So the normal assessment consultation process that happens has 3 phases. In the first phase, we measure EEG to build those 3D brain maps. So that involves wearing what looks like a swimming cap with little electrodes on it. And we just pop a tiny little bit of gel onto your scalp at each of those electrode sites so we can pick up what your brain is doing. So there's no injections, it's not painful, nothing's going in, it's just passively recording what your brain is doing. And we record that on a computer. And then the second section, your mum and dad and the child themselves, or whoever's with the child, goes off and meets with one of our psychology team. And in that meeting, there's a semi-structured clinical interview in which the psychologist will go through the main symptoms, and you get an opportunity to talk through the problems you're having in your school, in your home, for your situation. While that's occurring, we have the opportunity then to build the 3D models in the background. So the third phase of the consultation then involves meeting either myself or one of the neuroscience team, in which we talk you through the brain data that you recorded earlier on and the symptoms that you described to the psychologist. So we want to be able to see if we can see in your brain the types of symptoms you're experiencing. Because if we can see brain dysregulation in areas that we know are related to your problem, then it makes sense to make a brain-based intervention like neurofeedback training. Once we've completed the assessment here in the clinic, and we've ascertained as to whether we can link your brain activity to your symptoms, we can then understand if somebody's a candidate for neurofeedback training. Once we make that decision, a person can book in to actually start doing their training. With the clinic-based intervention, we're generally looking at about 20 sessions which occur over a 4 or 5 or even sometimes a 6-month period. And in those sessions, it's generally the same thing that's happening over and over again. So like your consultation, like your assessment, you come in, you put the cap on, painless, just put the cap on like a swimming cap, little bit of gel. And the child's job is to watch a screen and make the movie, for example, or the little animation play. So actually what's happening is we're measuring their brain activity in real time. We're measuring those brain areas which we know are dysregulated, which are causing the symptoms. And the activity of those brain areas is controlling what's on the screen. And accidentally at first, your brain will engage a particular type of activity that we're looking for. And because that happens just randomly at the beginning, we want to give you some reinforcement to tell you that we want more of this kind of thing. So, that activity happens, the child is looking at the screen, and their favorite movie or a game that they're playing plays randomly. What's happening in that instant is you have the desirable brain activity, it creates a reinforcement on the screen, and the child's brain says, oh, I like that. And that feedback loop then encourages your brain to re-engage that particular type of activity that just got reinforced. And over time, your brain learns through that feedback process how to make that movie play or how to make that game play. And actually what's happening is your brain is learning to engage in a particular type of activity that we're trying to encourage, that we know will reduce the dysregulation that's causing the symptoms. So in that neurofeedback process, the person is learning to gain some control over the way their brain is working. And we can track that across time. So we can make sure that your brain is learning. We can make it easier and more difficult as is required. And we can follow a training pattern to make sure that your brain is picking up what it needs to pick up. Alongside that, we're also monitoring behaviors, because it's good being able to change the way your brain is working, and those sessions are very engaging for children and adults. I mean, you're learning to control something externally just using your brain, so that's really cool. Alongside that, those brain changes, we're also assessing behaviors, because we want to make sure that the brain changes are actually leading to changes in behavior, so that once you're learning to make your brain work slightly more efficiently, that's making your behaviors easier to deal with and making your life better and easier to live. Some parents are worried that part of the intervention that we have involves their child watching movies or playing games on a screen, and screen time can be one of the big flashpoints at home, particularly when it comes to doing homework or particularly trying to get children away from video games at night time. And it's a very fair concern. So in the context of the clinical work that we're doing, it's quite clear to children, because we clearly contract with them about what the actual screen time is about, that it's part of the intervention, that it's something that we are regulating quite closely. It's not that they can just come in and kick their feet up and lie back and just watch a movie. It's an active training process. So if they don't concentrate and focus, and if they don't do the work that's required, the movie will switch off or the game will stop playing. So it's not your typical kind of passive reinforcement that you might get at home. And as well as that, it's quite easy for us to contract in that clinical context. So it's not like a sitting room where somebody can come in and just throw themselves down on the couch. It's quite clear that the child is here to do a job, and children are very, very good at that, and they respond really well. Particularly as our staff are so used to dealing with children with ADHD and different issues, that we understand that role of that clarity plays, and clear instructions and clear contracting around what happens in the sessions. Sometimes when parents come with their children, and in the context of the consultation, will sometimes say, he or she is just like me when I was that age. Maybe I have had the same problem, and I still find I have the same issues. I'm not getting on as well at work as I thought I would, and I'm just generally disorganized, and etc., etc. And the question often comes up then in that context about the ability of adults' brains to change. And people will often ask the question about neuroplasticity, or the ability of your brain to change the way it operates, or to change the way it's structured and functions. And the answer we give in that context is that the adult brain can learn and be as plastic as the young brain. What's different when you're older are the other pieces of the jigsaw. So you tend to have set up behaviors over the course of your lifetime which reinforce particular ways of doing things. You tend to be in a particular social context or a work context that reinforces a particular way of being. So the people that are around you, the places that you see, the things you do are all cues which create certain types of behaviors. So ADHD and ADD do go on into adulthood. There isn't a 100% conversion rate, but certainly it's not just a disorder of childhood. And one can be assessed for ADHD and ADD when you're an adult. In terms of changing behaviors and changing symptoms, you can focus slightly more on the environment and on your psychological skills as an older person with ADHD, because over time you have learned to do particular things. You have taken on particular types of jobs which you find easier, and you may also have beliefs and assumptions about yourself, that you're not able to do particular things, or there's no point in trying that because I'd never get it done anyway. So when you're tackling adult ADHD, neurofeedback training is certainly a very viable option, but we generally tend to do it in the context of psychological interventions or behavioral interventions which look at the three aspects of that biopsychosocial model. So we aim to work on physiology or biology through neurofeedback, and we aim to work on the social elements and the psychological elements through our psychology team. Neurofeedback training works using EEG or electroencephalography. And essentially all that is if you think about ECG for your heart, it's the same thing for your brain. It just picks up tiny electrical signals. And EEG was first really demonstrated back in the 1920s when a chap called Hans Berger first put sensors on people's heads, and he was also a neurosurgeon. He put sensors on brains, and he figured that you got the same signal from both. So he understood that you could get a really good sense of what your brain is doing from these external electrodes that just sit on your scalp. And that opened up a huge avalanche of research in neuroscience and human brains. In the 1950s and 1960s, then it became clear that humans could learn how to change brain activity by having that information fed back to them using EEG. So neurofeedback as a discipline is relatively new in that context. And what happened over the 60s and the 70s and the 80s is you had a lot of clinical applications, but not huge amounts of research. And I'm glad to say that over the last 2 or 3 decades, there's been an increasing interest in doing good quality, academic, peer-reviewed scientific research. And there are more and more studies which are emerging now which are showing the effects that neurofeedback can have in a number of different areas. ADHD is generally the area that shows the greatest evidence, but I also think it's important to point out that neurofeedback is not a cure-all for everything. It's not the silver bullet that's just going to solve all of your problems right now. Oftentimes when people come to us at the clinic, they'll have gone through intervention after intervention after intervention, and they find neurofeedback training and they think, okay, this is going to be the solution to all of my problems. It is certainly very effective. It is more effective in some contexts than others. And as I mentioned, ADHD is one of those contexts. So last year, there was a meta-analysis published by Jessica Van Duren and some of her colleagues. And they essentially looked at all of the available trials for neurofeedback training in ADHD. And they concluded that it was at least as effective as medication in the short and medium term in the treatment of ADHD symptoms, and that it continued to be effective when the intervention was finished. In other words, when you withdraw the intervention, you still see positive effects on the main symptoms of ADHD. And that's a really seminal paper for us, because we want to build our practice, and our clinical practice is built around good quality scientific evidence. there are lots and lots of different claims about neurofeedback training working in lots and lots of different conditions. But we in the Actualized Clinic stick very closely to the published evidence and to our clinical experience to make sure that what we're treating is actually good quality evidence-based work. A lot of people who arrive taking medication and they worry that they might have to go off their medication to start, or that it's going to somehow interfere with what they're doing. And the short answer to that is you don't have to change anything, that your medication is dealt with your medical practitioner, that might be your GP or your psychiatrist, and any changes to your medication should only be made in conjunction with that medical practitioner. We are happy to communicate with them, and we would encourage you to keep an open channel of communication with them, because as your symptoms change, it might be that they decide that your medication can change as well. But you don't need to stop, or you don't need to do anything different to come to the Actualized Clinic. You can just keep doing what you're doing, and we are happy to help in that communication process with your medical practitioner. While ADHD is probably the most common disorder we face in the clinic, we do see adults and children with a range of other different issues. In particular, we see a lot of people with depression, a lot of people who have chronic anxiety, some people with panic disorder, amongst other things. There is a lot of evidence to suggest that neurofeedback works for them, and our clinical experience would be that it works quite well. I mean, it doesn't work for absolutely every single person, but once we can link brain activity to symptoms, we know at least that that's a good step towards saying, right, neurofeedback is something that's quite useful for you. Generally, where we see emotional regulation problems or behavioural issues, people will arrive at our door and say, is there something that we can do to help? And in that context, again, it goes back to the same question. Can we link their brain function to their symptoms? And then if we can do that, there is sometimes a requirement for more or less other types of services around that, including psychological support, behavioural support, etc. Some of which we can provide here in Actualize, and some of which people can find elsewhere, but we can again draw people into our multidisciplinary team so that there is at least some unity of care that occurs for every person that we see. One of the most common things we hear from people when they come to the clinic, either parents of children or adults themselves, is that they feel lucky to have stumbled upon us. They don't know that, or haven't known that neurofeedback is an option, and they often have been unsure as to what to actually do, where to just get some information. So what we've started to do at the clinic is offer free confidential phone consultations for anybody who's interested. And that's not just learning about what neurofeedback is. We actually want to provide that service for people who just don't know what to do. So in that context, people can go to our website, actualize.ie, and sign up for one of those free and confidential phone consultations. And in that, they can present some of the information to us about their own particular case or the case of their child, and we can help direct them to particular types of services. Sometimes those services are in-house, or sometimes those are services which are freely available. They're available through the public system or maybe available from your GP. But what we're really trying to do is provide that first line of just basic, clear information. Because what we see repeatedly is that people are just lacking in terms of understanding what's actually available to them. So we're more than happy to facilitate people in that context. So we have a scheduling section on our website which helps people find a time that suits them. They can go on to actualize.ie, pick a time slot that works for them, and one of our team, either from the psychology team or the neuroscience team, will contact them and talk them through all of their options.